41. A client has a head injury with a Glasgow Coma Scale, GCS, score of 6. What is the priority action? A. Monitor hourly vital signs. B. Insert a Foley catheter. C. Prepare for intubation. D. Elevate the legs. Rationale: a GCS less than or equal to 8 indicates a risk for airway compromise. Intubation is often required. 42. Which assessment is most important after a lumbar puncture? A. Urinary output. B. Pupillary response. C. Headache and leakage at the site. D. Hand grip strength. Rationale: CSF leakage can cause severe headaches post-LP, requiring monitoring. 43. A nurse notes decorticate posturing in a client with a brain injury. This indicates abnormal neurological response. B. Damage to the cerebral cortex. C. Brainstem herniation. D. Spinal cord injury. Rationale: decorticate posturing suggests damage above the brainstem, cerebral cortex. 44. What is a priority nursing intervention for a client with a seizure disorder? A. Place in high Fowlers. B. Ensure airway patency. C. Start CPR. D. Restrain limbs. Rationale: airway is always the first priority during and after seizures. 45. Which medication is commonly given to stop status epilepticus? A. Phenytoin. B. Lorazepam. C. Diazide. D. Mannitol. Rationale: lorazepam, Ativan, is a first-line drug to stop prolonged seizures. 46. The client with increased ICP has a new episode of vomiting without nausea. What should the nurse do first? A. Record the amount. B. Notify the provider. C. Offer antiemetic. D. Reassess in 1 hour. Rationale: sudden vomiting may indicate worsening ICP, notify immediately. 47. Which finding is most consistent with left-sided stroke? A. Aphasia and right-sided weakness. B. Impulsive behavior. C. Left-sided neglect. D. Diplopia. Rationale: left hemisphere stroke often causes language deficits and right hemiparesis. 48. What is the best position to reduce intracranial pressure? A. Supine with legs elevated. B. A Trendelenburg. C. A head of bed elevated 30 degrees. D. Lateral with knees bent. Rationale: elevating the head promotes venous drainage and reduces ICP. 49. Which finding suggests brain herniation in a client with head trauma? A. Increased urinary output. B. Fixed and dilated pupils. C. Nausea. D. Drowsiness. Rationale: fixed pupils are a late, ominous sign of brainstem compression/herniation. 50. The client with meningitis reports photophobia and headache. What additional finding confirms the diagnosis? A. Muscle rigidity. B. Jaundice. C. Positive Koenig sign. D. Bradycardia. Rationale: a positive Koenig sign is a classic indicator of meningeal irritation. 51. Which intervention is most appropriate for a client with myasthenia gravis? A. Administer opioids. B. Administer pyridostigmine before meals. C. Limit physical activity completely. D. Avoid all medications. Rationale: pyridostigmine improves muscle strength and should be given before meals to aid swallowing. 52. The nurse notices a facial droop in a client and suspects stroke. What is the priority action? A. Give oxygen. B. Call the stroke team/code stroke. C. Check blood sugar. D. Perform range of motion. Rationale: activating the stroke protocol quickly improves outcomes, time equals brain. 53. In Parkinson's disease, what is the cause of symptoms? A. Decreased dopamine levels. B. Increased serotonin. C. Excessive acetylcholine. D. Low norepinephrine. Rationale: dopamine deficiency in the substantia nigra leads to tremors and rigidity. 54. A client with MS asks about symptom management. What should the nurse include? A. Use cooling measures in hot weather. B. Increase sugar intake. C. Use of narcotics daily. D. Limit fluids. Rationale: heat worsens MS symptoms, cooling strategies help reduce exacerbations. 55. The client with a spinal cord injury at C4 is at highest risk for A. Skin breakdown. B. Impaired mobility. C. Respiratory compromise. D. Constipation. Rationale: injury at or above C4 can impair diaphragm function and respiration. 56. Which is the most effective way to assess for orientation? A. Do you feel okay? B. Can you tell me your name, where you are, and the date? C. What's the weather? D. How many fingers do you see? Rationale: assessing person, place, and time directly evaluates orientation status. 57. A nurse caring for a client with aphasia should: A. Use complex sentences. B. Speak loudly. C. Use simple, clear statements. D. Avoid eye contact. Rationale: clear, slow communication helps clients with language deficits understand. 58. A client is being discharged after a stroke with right hemiplegia. What is the best intervention? A. Place objects on the right side. B. Use restraints at night. C. Teach use of left hand for tasks. D. Advise bed rest for 1 week. Rationale: clients should use the unaffected side for independence and safety. 59. A nurse is caring for a client post-cerebral angiography. What is a priority assessment? A. Respiratory sounds. B. Peripheral pulses and insertion site. C. Level of pain. D. Swallowing ability. Rationale: bleeding or hematoma is a major risk post-angiography. 60. A client experiences a tonic-clonic seizure in bed. What should the nurse do? A. Insert a bite block. B. Hold down the arms. C. Turn the client to the side. D. Apply restraints. Rationale: turning to the side prevents aspiration and promotes drainage of secretions.